Hi, my name is Daniel Regan. I'm the founder and owner of Healing Us Centers. We have a big problem happening in New Jersey, and I wanted to speak to you today about it. For far too long, our state has pushed and rushed to get regulation for the mental health and behavioral health space. The issue with doing it in this way is that a lot of the rules and regulations that they put in place create bigger issues, and one example is happening right now. In 2017, New Jersey created laws under Chris Christie surrounding cooperative sober livings called F-Series licensing. This allowed people to start sober livings on their own outside the Oxford model. The Oxford model was always created and fought for in federal courts to allow housing for people with addiction issues to reside in a house together and to find the recovery process. This is all done under a democratically run model where there was a president, vice president, treasurer, secretary positions in the household. This model worked great and has been fantastic and has been a cornerstone, but it didn't really take in the full scope of individuals that were needing this type of service. And therefore, people went out and made their own models of care of sober livings. The problem with this is that it was outside the scope that was protected. So New Jersey jumped in and started the F-Series. This was supposed to allow providers to operate houses outside the Oxford model within the regulations that the state provides. The issue is that when creating these regulations, they didn't have providers come to the table to help orchestrate these laws. We at Healing Us Centers have been operating sober living since 2015. We were one of the first people to get certified under the F-Series certification, and throughout the time for the past 7 years, there's been new laws and regulations coming in. There's a lot of gray area. There's a lot of interpretation of what the law says, and it's created a lot of obstacles for us throughout our time operating these sober livings. Yet, we have been able to stay in compliance for the past 7 years. But I have always argued that a lot of these regulations within the context of the F-Series license don't make sense. For one example, the regulation states that us as housing shouldn't allow drugs and alcohol in the house, or our members to have possession of drugs and alcohol in the house. Makes sense, right? Absolutely, it does make sense. But recently, last year, in 2024, the government released a statement that we can't discriminate individuals that are on MAT or psychotropic medications such as Adderall or Xanax for their mental health conditions. All of these drugs are also psychoactive substances, narcotics, and scheduled drugs. So how am I, as an operator, supposed to not allow it in the house, but also cannot discriminate from those that do get this from a medical provider? This obviously creates some turmoil in the way you operate a sober living. A normal person would typically say is, okay, provide some kind of medication management where you secure those medications that other people in the household can't abuse it or steal it from the other client, and that the client themselves who are given this medication can't abuse it. Well, that's not allowed by our state because you can also not provide services in an F-Series licensed dwelling. This is just one of many examples of the problems that we have in sober livings. Now, recently, we just received a notice from the state mailed to us. It was dated March 19th. We received it on March 24th about a law that they changed on January 6th. And they said that this law is now what needs to be followed 3 months later. I've reached out to several different operators. None of them knew that this law was changed on January 6th. It seems to happen behind closed doors. The new law requires us to have name another person an operator and have that person reside within the home. That person must be present in the home from 7 p.m. to 7 a.m. 7 days a week. Now, looking from an outside, this makes sense. This makes sense having someone that cares for the people in the house, also enforcing the rules for safety. I understand why this is done, but this new regulation has several problems with it and, again, has not been well thought out. For the last 7 years, I've operated my houses with 24/7 staff. meaning I have 3 8-hour shifts of staff members who are trained in mental health wellness, and first aid, CPR, Narcan training. And these individuals work their 8-hour shift, and the clients that are within the household or residents are watched over by these employees. Now, our state does not recognize 27 supervision anymore. They say that I have to have one of these employees reside in the house. Now I am considered out of compliance. My question is how do they think a live-in house manager that is only there or required to be present for 12 hours is more safe than 24/7 trained supervision? I don't think anybody logical can say that the latter is safer. The problem also with this regulation is requiring somebody to work 12 hours a day, 7 days a week. That's 84 hours a week. That's 44 hours of overtime. By DOL standards, if I am forcing you to work during those hours 7 days a week, you must be compensated for your time. Absolutely, understood. But at a New Jersey minimum wage, this comes out to roughly $73,000 a year. I also have to have another operator that's on call for the same hours in case the first operator that's live-in cannot be present for whatever reason. This is another $73,000 you have to be compensated if you're on call. When I asked the New Jersey State about this, they told me, well, most people are going to give them free rent. Now, this is wrong if you know law, because there's no way, one, my rent equals $73,000 a year. No one pays $73,000 a year to reside at a sober living. And two, if I compensated them still in rent, I would still have to give them a 1099, and they would be taxed on the compensation they received. Thirdly, we have an issue with liability, because when you are considered an operator by the state of New Jersey, which I am an operator of several sober livings, what you do is you are automatically personally liable for anything that happens in that house. Meaning, if someone passes away, if there's an overdose, some kind of centennial event, I am responsible for explaining what happened, and I am also responsible if there was anything that I did to cause such an event to occur. So to have a resident that lives at the house now be fully liable for the house puts them in a precarious situation when it comes to legal issues. When I looked into the liability situation, because typically you would have some kind of professional liability insurance or something of that nature if you're a provider, but because that person is a resident and it's not an employee, professional liability insurance wouldn't cover you. So that means that they're fully liable and at risk for anything that happens at that house. Now, a lot of people will say, good, they should be liable for what happens in the house. They're in charge of the rules. This is true and it sounds good, but most people that are going to find themselves in a house manager position are in their early recovery as well. No one that has life going and has a family and all those kind of things are going to be a house manager at a sober living. It's going to be someone on the recovery process themselves. They are going to be working a normal job. How am I supposed to elect someone to take the full responsibility of the house in this capacity? Furthermore, how am I going to find someone that wants to take on this liability and commit to 84 hours a week of mandatory time spent in that house? How am I supposed to navigate this as an owner of sober livings? This is where the difficulties start and why these laws do not, or this regulation doesn't make sense. This is going to create many different barriers to care. This is going to create a hardship on people who run and operate these houses. And it's going to push people away from opening up more houses. And the reality is that we actually need more beds in New Jersey for people that are seeking care and these services. So when I went to the DCA and spoke to them about answer my questions, how am I supposed to navigate this? How am I supposed to navigate DOL law, IRS rules with what you're asking of me to do? They do not have any answers for me. It's clear that no one has thought about these issues and how they would arise. And their answer simply to me was, I don't know, I just enforce it, which is very problematic because I want to be in compliance. I think everybody who runs these houses, the people that are doing the right thing, we all want to be in compliance. We all want to follow the rules, and we want a voice at the table. Yesterday, which was April 7th, we had our annual inspection at one of the houses, and due to us still having 24/7 staff and not being able to hire a live-in house manager yet, we were found out of compliance, and they hit us with a fine. This fine will continue. I have 30 days to correct this issue. I am trying everything in my power to hire a person for this position. But due to these constraints, it's really hard to find someone that is going to want to take full liability, commit to 84 hours of work a week. In the state's eyes, they think that I'm going to just give this person free rent. So I don't know who's going to work 84 hours a week for free and take full liability. The state also said, well, don't worry, because they could sleep during those hours as well, which was really concerning to me because this whole regulation was created for safety reasons. Now they're telling me that the mandatory hours for that house manager to be there, they could be sleeping the entire time. How is this safer than me having an awake, trained 24/7 staff? I have no idea. I've spoken and reached out to many different providers throughout New Jersey. We're all deeply concerned about what this regulation is going to do. We wanted to band together and have a voice at the table, and that's why I went and created New Jersey Coalition of Treatment Providers. We're going to band together, and I want representation from all service levels, from treatment to hospitals to peer support to individual practitioners, and bring everybody to the table and formulate rulings that work. We want regulation. We invite it. It keeps us whole. It keeps client care the priority at the end of the day. We just need regulation that works, and when applied to real life, it functions. And right now, that's not what we have in New Jersey. And because when you have laws that do not apply to real life and they force you to break rules on the other side of the table, what happens is people find loopholes. And that's what I want to get away from. We want to close the loopholes. We want regulation. We want people doing the right thing for these clients. And it should not affect those who are doing the right thing already. We are banding together at New Jersey Coalition of Treatment Providers. I would love for you to join our mission and have your voice. I would love for you to come sit at the table and give us your perspective, because we're going to Trenton and we're going to bring them a blueprint of how to do this correctly.